Hey, good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio. Delighted to be back with you on this Wednesday morning. Chilly, a little damp, but our spirit is undiminished. Unfortunately, Hawkeye, the numbers are not undiminished.
No, they're not. We know there's vacillations, there's an equilibrium at any running 7, running 10, running 14 days. I think we've reached that right now. Hopefully we aren't continuing to go up as we did just about a week ago.
Those are bad days.
Yeah, I would prefer the levels to be in the 30s, but unfortunately they aren't. They are still very high. We have 91 active patients in the hospital with 47 in the ICU and 21 of those on the vent. We still do have 46 of those recovering patients and 5 on the ventilator as well. We did have 3 deaths overnight, though, unfortunately. Hays, though, luckily, has seen their numbers decline just a little bit with no deaths. They have 37 total patients in the hospital. 33 of those are active and 4 of those in that recovery period. So maybe we are getting to an equilibrium right now and not pushing up above 100 as we thought we were going to do. But again, we are heading into a very busy weekend, and there will probably be a lot of private get-togethers. So keep our fingers crossed.
Yeah, I think that's right. And to your point, we've been in the 90 range now for about 4 or 5 days. And so that's a lot better because we were going up by 10% every 2 to 3 days. We're not doing that right now. I think that's good. I do think it's also interesting if you look at the metro area data, the case numbers have kind of leveled off a little. And they actually dipped the last 2 days. So I'll take that. Yep. And I don't know exactly the reason. I'm going to say it's because schools had let out. There's a little less activity around that. I think people got the message, and I think my sense is there's more mask wearing, and I think that people are taking it pretty seriously. And I think that it's I think that is probably contributing towards what we're seeing right now. So I'm happy about that. Not happy about the overall numbers, but happy about where we are right now relative to not going up anymore. Joining us today is KU Chancellor Dr. Doug Girod, good friend, and our Vice President, as well as our Vice President of Systems Innovation and Integration, Chris Wilson, another good friend. And we're going to talk a little bit about how folks ended the school year at the university, as well as what's going to happen to restart the next year and all things in between. So we'll turn to that. But first, what kind of questions do we have out there from reporters? Man, we have solved coronavirus. Nobody has questions. That's impressive. That's impressive. Okay, Doug Girod, how are things going out in Lawrence? And how did the end of the semester, we were talking just before the show started, you said classes ended officially yesterday and people started going back home. How was it?
Yep, we made it to the finish line. You know, I think when we started out this semester, we weren't really sure how it was going to go. Obviously, we put a lot of work into preparing for the semester. I think we had a really good plan in place. We had a lot of modifications to facilities. We had technology upgrades. We modified the curriculum, de-densified the campus, and then with the aid of the health system, did a very extensive testing program. Actually, the biggest testing program in the state, I believe. I think we've completed over 39,000 COVID tests over the course of this semester, and I think that plan really worked. And working along with the Pandemic Medical Advisory Group, which of course, Steve, you chair for us, but David Wild and Chris Wilson are on that, as well as our leadership team from Watkins and the leadership from Lawrence Memorial Hospital and Douglas County Public Health really helped, I think, guide us through this extremely well. And really want to thank Dr. Sarah Pauly and Dinah Malott at Watkins Health for leading the charge on campus through the course of this semester. And I think really with all that effort, I think we created the safest spot in the state of Kansas, quite honestly, which is the campus in Lawrence. I just don't believe there's a safer place. And we have no documented cases of spread on campus in any official setting. And obviously, like everywhere else, the risk is out in the community and how you behave out in the community. But really proud of the faculty, the staff, and the students, and really toeing the line for the most part, and getting us through this with really relatively low numbers. And like everywhere else, Douglas County has been one of the lowest in the state of Kansas. We, over the last several weeks, did start to see a climb. And I guess I would pitch it to you guys to ask the question if you think Halloween had anything to do with that, because we really did see climbing numbers.
Yeah, for Halloween.
Yeah, and now they're starting to dip again. So it makes you wonder, but it also makes you nervous with Thanksgiving right around the corner.
I think that's exactly right. And I do think Halloween had something to do with it. I remember I told the story earlier, right after Halloween. My wife and I had gone out on a bike ride because it was a Saturday. And when we were returning, it was Saturday, and it was like 5 or 5:30. It was before the time change. It's still, pretty light. But the kids were out, and they were doing their thing. And we went by a couple of neighborhood block parties where people were closely congregated. Yeah. There was clearly alcohol, and there were no masks. And you're like, guys, do you understand that this is a really bad idea? Because who's going to get spooked here? It's not the kids. It's going to be what happens to you when you get COVID. So I do think that had a lot to do with it, Doug. And I also think that eventually the opening of schools kind of caught up, and not so much. I think KU did. KU is a remarkable story because you're in the middle of Kansas, where the pandemic is, obviously one of the worst right now in the country, and in a no mask state. Douglas County had more of a mask mandate and had more strong public health measures in place. But KU is a success story relative to other universities. You have other universities closing and having a really widespread infection, having to shut down and just go to online learning. But KU thrived, and I think that it was because of the strong action of their chancellor and everyone around them, and the faculty and the students. I think people got the message. I think that things worked. I think Mask Up KU worked, and I think you guys did great. Yeah. So I don't know. That's my sense, Dana. How about you?
Yeah, and I really think we have to understand that really, if you look at kansascity.com, the rolling 7-day average started to turn up pretty steeply, probably around October 25th and 26th, so right before Halloween. We know that hospitalizations follow cases by 7 to 10 days. So we still have a lot of potential hospitalizations to go through, even though we are hopefully and we are optimistic that we are seeing a little bit of dip in those overall cases for the running 7-day average. I think we still have a long way to go. Yeah,
I do too. And I think to Doug's point, Thanksgiving. Yeah, let's be real careful with that one, because that could be even a bigger gathering than Halloween. And so what could come out of that could be even more difficult, I'm afraid. So Chris Wilson, you worked really hard on this, and I may have chaired the pandemic medical advisory team, but the truth is I was a do-nothing chair. You did all the work, and I just want to say thanks to you. And what is your sense of how things went and what to expect coming back?
Well, first off, Dr. Stites, I think you're being a little modest on your contribution to the effort, so we greatly appreciate your help. But so I think it was a great case study in collaboration and using public health and infection prevention principles. What we saw over the course of the 40,000 tests and positivity rates over the course of the semester was exactly what we all were just describing. Is we actually had our peak positivity rate 2 weeks after the entry testing was conducted at around 9%. I think Nick may even have some diagrams here.
Okay.
We hit our low 3 days before Halloween. And so if you took a look at 2 days after, or 2 weeks after Halloween, we went from a 1.5% positivity rate right before Halloween to about a 6% positivity rate middle of November. We've been able to pull down a little bit from that, so we're right at under 5% now. But that I think is indicative of what we see when we have these settings where people get together in these casual formats and maybe let their guard down from what they would otherwise do from a formalized infection prevention practice standpoint when they're in, say, a classroom or a workplace or an athletic organized event.
I think that's the story of the COVID virus. Yeah. Anytime you let your guard down, COVID does what COVID wants, and it comes around.
But I think what Dr. Girod said is so important, and what Chris said is so important. In that space, on the campus, with those engineering and safety protocols that were taken into place, the de-densifying, the masking, all of those other things, that was an extremely safe place. It is out in the community where you're having spread, and people maybe not taking the optimal approach to public health and medical guidance for helping protect against infection.
Yeah, I think it's remarkable that even the fraternities and sororities got things under control.
Yeah,
so they did a great job.
Initially, it was pretty rough, but I think it got a lot better as the semester went on.
So, Dr. Girod, how will things open back up? Well, first of all, talk to us about how students exited the campus and exit testing, and then what do you think is going to happen? How will it go when they come back on campus?
Yeah, so as we thought about the end of the semester and students heading home, wherever home is for them, it was clear that, well, first of all, depending on where you're headed, you might be required to have a test before you can get home. Certainly there are some states that are requiring that in some countries. So we offered that to students, and then we also offered it to those who had, those at high risk at home as well, emphasizing, however, that a negative test doesn't guarantee anything, and you still need to do what you need to do when you get home, which is to quarantine yourself before you start commingling with your loved ones, to take that extra precaution. And then we have some students, particularly our international students, will still be in Lawrence until finals are done, which is middle of December. So that will exit testing will continue through Watkins Health through that time frame as well, to accommodate those people that are not going to be leaving campus yet for a few more weeks. And then we think about next semester, about spring, and we took a similar strategy, which was to try and minimize student migration. And so we put spring semester as the first week of the semester, so we're starting a week late, and we won't have that break in the middle of the semester where people will be headed all over the place and then coming back, and we will be conducting mass testing again on entry testing as we did in the fall, and that was very effective. And if you look actually at I think over the course of from our testing August 1st to now, we had about 1,300 positive tests. Over 800 of those came out of asymptomatic testing, both our entry testing and our prevalence testing. And so that's a strategy that we will use again in the spring as we welcome our students, faculty, and staff back.
And I think that asymptomatic testing is really remarkable. The Danish or Norwegian data report? Oh, no, Iceland data reported they had a 40 to 45% asymptomatic, people who were positive were asymptomatic. And so, then the CDC recently said that maybe half of all the transmissions are coming from asymptomatic patients. So I think the numbers are consistent, making entry testing, like you've talked about, just so darn important. We've said, I think we described it as a mass migration. It is a mass migration, and everybody coming in, you just got to be careful, especially when they've been coming back from break. So hats off to you all for doing a great job and leading the way and showing us how we could do this right and keep things safe correctly. And that is a message to everybody out there in public. If college students on a college campus, which are the highest risk group for transmitting the disease, can keep it safe, so can you. And the principles of infection control work wherever you go, whether you're on the Lawrence campus or you're at the grocery store.
Yeah, we've continued to give this message, and people get frustrated. Healthcare providers get frustrated. But if we continue to give that message, hopefully it will get to those people who maybe initially haven't taken up with that. So keep doing those things. Everybody out there, maybe people don't want to hear the message coming from us, but they would like to hear it coming from friends or family. So keep giving that message and just keep fighting the good fight, I guess, because we are all in this together. There is a light at the end of the tunnel, but we got to keep being vigilant until then.
Yeah, one of our liver transplant surgeons texted me this morning and said that not wearing a mask is playing football without a helmet. And I was like, first of all, that's pretty good for a surgeon. And second of all, I'm just kidding, but second of all, Dr. Girod's a surgeon. I have to be really nice. I shouldn't have said it like that.
We could have said ortho surgeon. They're pretty simple.
We got to be nice about that.
Knee fix bones.
Yeah. I did not say that. I love my ortho surgeons. I go to them all the time.
That's to you, Dr. Soika.
Yeah. But the truth is that, it is a gamble, and eventually that gamble is going to hurt you. And you see that in all the counties that don't wear masks, that have twice the rate of infection than those who wear counties that they do wear masks. This is not hard. It's actually pretty straightforward. Okay, questions from reporters, any media out there? Jill.
Last call for media then. Joanne says she understands that some students stayed because they're going to take tests, but she wants to know, did any students stay on campus over the holiday because of being afraid of carrying COVID home?
Oh, that's a great question. Dr. Girod, did people stay on campus because they were afraid?
Well, it's an interesting conversation, right? Because when we started the semester, we were actually really concerned about what it meant to bring all the students into a community, the community of Lawrence, and what risk that put the community at. And interestingly enough, right now, as we think about sending our students home, we're sending them out of the safest place in Kansas into hotspots everywhere else. And so, it's really the opposite problem. But certainly there are students that we're very concerned about who have, parents who maybe, or siblings who have underlying health conditions would be at higher risk. And that was really the strategy behind the communications of both quarantining before you commingle with them and getting exit testing to try and minimize that risk. But really the quarantining is the key thing, quarantining and mask wearing when you do go home. And so I'm not aware of any that are staying because they're afraid to go home. We certainly, some are staying. A lot of our international students stay. They don't travel back to their home countries over the holidays typically. So we do have some that'll stay, but I'm not aware of any that are concerned about return home.
Heather says that we've talked a lot about the need to be quarantining for the whole 14 days and not being able to test out. News reports today are about a CDC proposal to reduce the quarantine to 7 to 10 days in hopes that more people will take tests and be compliant. She was wondering if she could help.
Yeah, let's talk about that because they haven't announced it yet. They're talking about it, which I think they're going to come. But it comes with a very important caveat. 7 to 10 days and you're asymptomatic and you have a negative test. So it's not just, I can do it for 7 to 10 days, which means you've got to have the testing capacity to do it. And you have to be taken a step further. You have to have a negative test. I don't think an antigen test should count on this, Hawk. So let's see what you think. But follow up, some people can't get their test back for 3 to 4 days. So the reality is you can still be almost 14 days. So let's talk about the practical implications.
Yeah, absolutely. First of all, I agree with you. You need to have a PCR test.
Yeah.
We know that that is the gold standard. Preferably an NP swab. There are other mechanisms, anterior nares and saliva, but I think let's start at the NP nasopharyngeal swab.
I just don't want it to be an antigen test because I don't know what a negative antigen test really means. I know what a positive test means. That's okay. You're positive. A negative antigen test and a 7-day time period means, you still probably have a 10 or 20% chance of developing the infection and then infecting others.
Right. And we've discussed this in the health system with our employees and with other institutions that we've worked with, including University of Kansas, about reducing that. But still, the data would show and would suggest that you can still incubate or harbor the virus for up to 14 days without any symptoms. So I think that's very important to understand. If the CDC does release new guidance, we will certainly follow that and do what is asked as far as testing. We are also testing in our employees that do have exposures. We're testing at that 6 to 9 day mark. Because we know that the majority of people who will have symptoms will be at 5 to 7 days. However, we know anecdotally we've had employees that have had symptoms at that 12-day mark as well. So we'll wait to see what the new guidance is, but I think to your point, it's very important to be able to get that timely, efficient, accurate test so that you can get the results back and kind of go from there.
Yeah, I come back to it's 7 to 10 days with a big caveat. You got to have a negative test, which means you got to go get a test. And then I don't think it should be an antigen test. We'll see what the CDC says. But if you get either a swab or a spit or an oropharyngeal swab, the key is that test has to be negative and it's got to get returned back to you to be negative. And I think we also have to be thoughtful that if numbers really rise, that guidance will put an increased burden on testing facilities than is out there right now. So be thoughtful about that. Chris Wilson, any thoughts you have about how that would work out as far as testing goes? You worked a lot in the testing sphere throughout Kansas.
Yeah, my hope for the coming 6 months is that we can increase access to testing. So I think it's a good exercise here for the CDC to look at alternatives to the quarantine and including testing out of quarantine as part of that. But the practical nature of access to testing still remains a challenge. And so if we did have to look at alternatives to PCR, I would promote looking at how we can make them more frequently available and results. So the time factor is really the key. It's not just having a test completed, it's getting the tests available at a more frequent interval and getting the results back in a more rapid time frame than they might be available now. So frequency and turnaround time is I think, a key to how you might be able to modify some of these quarantine protocols that we've been living with for the last 6-8 months.
Yeah, I'll tell you, one of the things that warms my heart about the what appears to be the new coronavirus task force is the emphasis on testing, getting information out, and having a very disciplined approach and a consistent message across the country. I think that's really important. And I got to say, I'm really happy Anthony Fauci's still going to be there.
Yeah,
I think he's just done a great job. I mean, he's the Patrick Mahomes of infectious disease.
There's a couple of viewers that apologize for being late to the show, and then some that are wanting a little bit more clarification. But could you go back to students going home from college? What does quarantining look like in the house? How long do they need to do it? What is the biggest concern? What should the family do? Okay,
students coming home from college, what should they do, Hawkeye? What's your recommendation? And Chris Wilson, you guys have worked on this with for KU. Okay, one of you has to answer. Go first, Wilson.
Yeah. So sure, yeah, I'll give it a shot. Yeah, I think that it's important to understand the activity of the individual prior to them coming home. If a student has been
he's freezing up
for the prior 10 to 14 days, it's a different scenario than if that student has been at the bar since last Thursday, Friday. So I think that's the key is what the behavior has been prior to them returning home. Once they do arrive home, I think let's think about this as a household. So we've got a household of your family that you're returning home to, but we've also got the household of the college student. That household may include just their roommates, but it may also include, if you're living in a large congregate living facility like a fraternity or sorority, it may include dozens and dozens of other people. And so I think we need to just be thoughtful about what that household combination looks like. When you're combining a college student with, a household in the student's home in the hometown. So I'm less, I guess, encouraged by the prior behavior of the college students, just because we know how they can be wired, and I know how I was wired when I was a college student. From that perspective, I think there's just opportunity for honest conversations among family members about why they think infection prevention principles like masking are important. And I think masking at home is something that is reasonable. I think it's reasonable distance at home. If there is any question about what the interaction of the individual returning home has been.
No, I think that's exactly right. So, Hawkeye, what are your thoughts around this?
Yeah, I would agree with his first point, and this is what we've talked about too. Although the CDC recommends that people not travel for Thanksgiving, we said there is optimal public health and medical guidance, and then there is what is really going to happen. So this time it becomes individual risk and the ability to mitigate that risk of spreading the disease. So if you have to travel, for instance, if you are coming home from college, if you're coming home for Thanksgiving, what are you doing beforehand? And that was Chris's first point. Can you have been quarantined or isolating for 10 or 14 days prior to coming home, or are you out at parties or gatherings prior to that? So doing that quarantine or isolation that 10 to 14 days prior to coming home, but also how are you traveling? Is it airplane or driving? We've always said driving is much safer than air flight at this time, just because you are going to be around so many people. I know KCI has had a lot of people go through within the last few days. So anytime you're increasing the number of people that you're around, you're increasing the chance that one or a few of those people are going to have coronavirus. And then once you get home, we know that there are ways and mitigation strategies for reducing risk of spreading the infection to household members. That includes being in a separate part of the household, if that is readily available, if you can do that. Masking indoors is certainly one of those things that has been shown by several publications to help reduce the risk of spread in the household, because we know the household spread can be up to 50%, especially within their first 5 or 7 days of the infection as well. So doing those things, maintaining distance in the household as much as you can if you can't isolate somebody to a particular wing or area of the house. Those are all things that you can do in that time period after somebody arrives back from college.
I'll just say, I think that the other point to remember is that coming back from college isn't really different than anybody traveling from anywhere.
Right.
The reality is you have to figure out and just have an honest discussion. What have they been, how have they been behaving, what have they been doing, and then how safe do you want to keep your household, and what are your personal risk factors? That's all part of the story. It's part of the equation. But the truth is that if someone's coming into your bubble and you don't really know what they've done, and you need to quarantine. Mm-hmm. And I think that's how I would look at that. Dr. Girod, talk with us a little bit, because I know you've been engaged with the Lawrence business community to try and make sure that because there's this very collaborative relationship between the university and the business community. Talk to us a little bit about how that was, how you had those conversations around the student behavior, mask wearing, bars being open, things like that, because you all need each other.
Yeah, we started very early on a unified command with Douglas County Public Health, the leadership of Lawrence, and the Chamber of Commerce and other partners in the community that we convene at least a couple times a week to really review the numbers, review the policies, review where we're at, what we're seeing, what the latest science is. And that really has guided our entire community, university included, through this. And so that collaborative effort we didn't see across a lot of the state, unfortunately, but that really kept the entire county, Lawrence community, and the business community in lockstep throughout this, and incredible amount of collaboration that really kept our community safe and our university safe, and wouldn't have been possible without that. And it's a challenge. I mean, the business community understood very well that number one, they needed the university to be open for them to be viable going forward. When we're the largest employer, obviously, in the community, and the students coming back are big drivers of economic activity here, and yet they also needed to figure out how to do it safely if they're going to be able to stay open. So obviously, we had an alignment of ambitions there as we went through the semester, and I'm just really grateful for that collaboration, which, like I said, I think we did not see across much of the state.
Yeah, I think that's the message, right? You can stay safe and you can stay open. And in fact, the two things, as opposed to butting heads, are actually parallel. They need to be done together, because you stay open by staying safe. Otherwise, that's when trouble really begins to arrive. Jill.
Terry has a question about people that are asymptomatic. A family member she was asymptomatic. Does she have antibodies?
All right. I think, Hawkeye, you can get antibodies even when you're asymptomatic. And I think that there's no data to contest that, because you still have had the infection. Yeah,
you can still get antibodies. The question is, with asymptomatic disease or mild disease, we don't know really the titer of that antibody. We also don't know how durable it is, how long will it last. There's been a number of different studies showing people that with mild to moderate disease may not have detectable antibodies for as long, but there are other studies that show that they do have detectable antibodies for as long as people who have had, say, more critical or severe illness. So you certainly should be able to mount antibody responses, but they've also found subsets of populations that had mild or no symptoms that don't have antibodies but do have T-cell responses. So T-cells are one of the other components of the immune system. So it varies from research study to research study, but in general, really with any foreign substance or foreign entity that your body sees, you should mount an immune response to that, so you should have antibodies that can be detectable. And even people who don't understand if they have been ill, maybe they had some sniffles or they felt they had their allergies, and they go get tested for antibodies to see if they've had exposure to SARS-CoV-2, they found that they have had detectable antibodies. So yes, you should have antibodies because your body has seen and recognized that virus.
Donnie said that she was over at KU the other day, and she did see some people walking down the hallways, and they were eating and drinking on the move, and naturally their masks were pulled down on the chin. She's wondering, is it okay to eat and drink on the move? Is that safe?
Well, you can eat and drink in the move. Now, I got to be honest, if I tried to do that, I would run into a wall. So I would say it's not safe. I would stumble, I would fall down, I'd go down. This would not be a good story. But the real problem is you can eat and drink on the move unless you're with somebody. If you're with somebody, then it's not safe. And it's the same. The rules of infection control are true wherever you go, whatever you do.
Yeah, because more than likely you're probably walking pretty close with that person, not 6 or 8 feet away as well. So I think that's the big issue here. Again, it's probably not optimal practice, but it happens.
Especially if you're clumsy like me. So, Dr. Girod, would you walk and talk and drink and eat all at the same time without a mask?
I'd end up wearing whatever I was trying to eat, so I probably would not.
So, I know that Amanda Gartner, who is the head of our infection control program at KU, she's on the program frequently. She goes over and she does these spot checks. I mean, she does a remarkable job. Right. And she goes and she hangs out and she counts the number of people who are wearing masks. And then she gives us a report. And she's reported on the campus, the compliance is like 95 to 100% all the time. Is that what you think too, Dr. Girod?
Yeah, that's really what we see. I mean, the compliance, especially, it took us a week or two to get there, particularly for people to wear their mask outdoors. But really, the compliance has been remarkably high, and I think that's been part of our success. And even when we've had our events, like our football games, our indoor volleyball games, our soccer games, Amanda's actually been really helpful, as has Chris Wilson, to help us design how to do that safely and how to have those relatively mass gatherings. And we are unaware of any transmission at any of those. And even after our first football game, we did a lot of prevalence testing of people who attended that game and did not identify any cases coming out of that. So I think we know how to do that safely, utilizing the same criteria that we've used for everything else. That being said, with what's been spiking, across the state right now, and starting to see even in our own community, we made the decision not to have fans at our sporting events for the rest of November. And then just this last week, working, as you know, Steve, with the pandemic medical advisory team, we had a robust conversation and really decided probably the first week of December, it didn't make sense to have fans in the stands either.
Well, and I think that's right. As the numbers were rising and things were spiking, we were getting pretty nervous about that. So I think made the right choice, a hard choice, but the right choice. So what do you think as the campus reopens? Same mask policy, same dedensifying? How will that be approached?
While I'm so excited about the news that we're getting about the vaccines and the availability of the vaccines, I really don't believe that the timing is going to work out that we'll see any significant part of our population have access to that vaccine prior to school starting at the beginning or end of January. So I anticipate the opening of our spring will look very similar to the opening of our fall. I am hopeful also, though, that we have shown that we can conduct our business safely in our spaces, and so I'm hoping that we will be able to offer more face-to-face activities for our students as we've proven that it's safe to do so. Really, that fall was a proof of concept of that, and we've shown that that's true. And while we have had faculty and staff and students obviously test positive, and a few students hospitalized, they did not pick up that illness at work on campus. They picked it up in their lives otherwise, which we're all at risk for. So we know that we can have students in the classroom in a very safe fashion, doing the social distancing and the mask wearing. We're adding medical grade air filtration to 423 classrooms over the break. We know we can do that, so we hope that we'll be able to offer more of those face-to-face activities, and that would be a little bit different than the fall. I think we probably over-dedensified in reality, looking back at how well it's worked out.
Yeah, so I think those are all great points. And and I think the medical grade air filters, now what's going to happen is students won't have they will no longer be able to say, I had a cold, I can't take that test, because you're going to make the campus so good, they're just all going to be healthy all the time.
Right, 100%.
Yep.
Isaac wants to know if you've done any polls on campus about taking the vaccine, and if you will, when it's available, require it for students. What is the feeling on campus about that?
All right. What do you think, Doug?
Yeah, we've not sent a survey out about that. I mean, I think we've all seen some national surveys that suggest that maybe up to half of the population are not willing to take the vaccine at this point, or afraid of the vaccine, perhaps. So we haven't done that. We have just started the conversations, and I might ask Chris Wilson to jump in here. He's been a big part of that conversation too. I do think the one area that we may ultimately require it for next year will be in student housing, where we have conjugate living that we control and is ours, and we're responsible for. So I think that may be a setting where we require it. But all those conversations are happening. Chris, what are you hearing in those meetings?
Yeah, if you think about it, some of these 90+% effective vaccines that we're seeing right now in the early data, but only half the people are willing to take it. It's really only a 50% effective vaccine. So the first point I make is that the infection prevention principles, particularly masking, that we're promoting now are going to be the best defense against coronavirus into the new year, regardless of the situation with the vaccine. That said, I do think that vaccine distribution is going to be the challenge of the new year. I think administration distribution, guidance from our federal and state regulators will be really helpful, but just the practical nature of getting buy-in, particularly for groups that maybe have not had a lot of trust in, public health programs like this historically, is going to be a real effort that's going to have to undertake. And I think, if you think about masking, distancing, and now vaccination, we know all of these efforts work from a medical standpoint. And where we are right now is I think we're going to have sort of a paradigm shift of moving from sort of a medical intervention model to a behavioral science one. So what do we need to do as public health stakeholders to make sure that every type of group out there feels encouraged and safe about receiving something like a vaccine or understands the reasons why we think masking is important? And I think that a lot of that will occur with larger organizations like KU in coordination with their local health department and state health departments. And so there's been quite a bit of collaboration so far between Douglas County Health Department and the KU campus on, for instance, surveying individuals in the community about receiving a vaccine, about vaccine distribution methodologies, of course, the logistics side of things with different types of vaccines, whether, how cold they need to be kept, working with Lawrence Memorial Health on their resources as well. So again, the same collaborative efforts that we worked on this fall with infection prevention principles will be the same ones that help us get through after the new year with vaccine distribution.
Yeah, and I think the other thing to say is I don't think here at the health system we're actually going to require the vaccine, and here's why. When the vaccine comes out, it's going to have an early use authorization. It won't technically be FDA approved. Right. And so it's a little harder in that situation, I think, to require it. Now, as more evidence comes out and the drug's FDA approved, then I think we're going to have a different stance. We still have to look at the side effect profile of the data because we don't really know that yet. All we know is what the companies are reporting, which isn't the same thing as showing it to the country, like going to the New England Journal of Medicine or the Journal of JAMA, the Journal of American Medical Association. Those first vaccine trials will be published in one of those two journals because they're going to belong there, and we're all anxious to see that data, get our hands on it, and think through it. But I think we're going to have to see all that information, make sure that as it's been used in the public, it's working well and without a significant number of side effects, and then it'll go back to the FDA for full approval. And at that point, I know the health system will probably adopt us. I suspect. We have not had that level of discussion yet, to be clear, but I think more places will start requiring it. I think it's a little harder to do it while it still is under an EUA. Yeah,
and to be clear, we have a number of vaccines that are required in order to work in the health system. So this is not new. This includes hepatitis B, your tetanus pertussis, influenza, all of those things. So that is a different subject. We do have a number of vaccines that are required to work in the health system. I think Chris's point was exactly correct. There's always going to be that subset of population that doesn't want to. And if people are fearful or concerned about it right now, and if it's that high percent, that's okay. There's always going to be that 1% of the population that won't do it, the anti-vaccination group. Again, in my opinion, that's exactly wrong and unsafe. But then it's that other part of the population that right now doesn't want to take it. But I would encourage you to look at those published studies, whether it's New England Journal of Medicine, JAMA, the Lancet, because those will all be transparent. You will be able to see the safety data and the efficacy data. Do your due diligence to understand all of those topics that you have a concern about. And if you do have other concerns and you don't have access to those, then talk with your primary care provider or your other physicians to really get the information so that you can get the best data that you want, the best knowledge that you want, so that you're able to get the vaccine and keep yourself and your family safe.
Final question, Jill.
Yeah, okay, so we'll get to the final question. I want to acknowledge that everybody is asking a lot of vaccine questions, and the week of December 7 through December 11, we are going to have an all-star team, and we're going to dedicate the whole week to all things vaccines. So mark it on your calendar, December 7th through the 11th. Joanne gets the last question. She has sisters that live in Iowa. And the small county where they live, the public health department is saying, once you get COVID, you cannot get it again. Is that true or false?
It is false. We have clear evidence that you can get reinfected. It's not as common, obviously.
Correct.
But you can get reinfected, and some people do fine with it, Dana, and some people not so fine.
Yeah, there have been very well done published studies. Unfortunately, to know about reinfection, you have to have the first isolate so that you can do genomic isolation and sequencing, and you have to have the second isolate so you can do genomic sequencing. Unfortunately, that is not really done in most hospitals or labs around the United States, but we know that reinfection happens. There has been very good published reports about that. We don't know, at least for the majority, we're thinking it's going to be probably more than 90 days after your first infection. But we have seen reports of 60 days. We know that there have been longer as well. So getting the infection once doesn't negate you the need to do the masking, the distancing, not gathering. That is very important to understand. And I think we are actually investigating a possible reinfection here at the hospital right now. So reinfection does happen. If you get infected, you need to continue to take those public health measures, masking, distancing, not gathering in large groups, hand washing, all of those things, because we know reinfection can happen and we don't know exactly what's going to happen once you get reinfected. Some people have had mild to no symptoms. Some people have had worse symptoms. But I think more importantly than all of that, can you still spread the disease? And that question is unanswered right now.
All right. As we wrap up the day, I want to first turn to Chris Wilson. Final thoughts.
Yeah, you know, on the edge here of heading into the holiday season, I had the opportunity to speak with one of Dr. Girod's faculty members, Derek Reed, earlier this week, and he's working on some data right now that shows the larger the crowd and the less familiar the group that you're with, the more likely you are to mask. The more familiar and the smaller the crowd is that you're in, the less likely you are to mask. And that has just really stuck with me here as we head into the holidays. And I think about, you know, this day when I was in college. The Wednesday before Thanksgiving was one of my favorite days of the year because I got to go to my hometown, go out to bars and see all my high school friends that I hadn't seen in so long, many times hadn't seen since the prior Wednesday before Thanksgiving. Maybe stay out too late, maybe sleep in a little bit and then wake up to a great meal. I think this year's got to be different. But I also know that our college students are wired the way that they are. And if you have been socializing, if you have been going to parties and bars over the last several days, and will do so tonight, I guess my final hope would be that you consider what infection prevention measures you take tomorrow on Thanksgiving, and would just ask you to wear a mask. And I think that this next era of our infection prevention work is really going to be about individuals making these kinds of decisions and understanding and getting comfortable with them. And so I just hope that everyone has a very safe Thanksgiving and does get to spend time with family, albeit in a different format this year.
Thank you. Well said. Although, are you going to the bars tonight?
Mm-hmm. Nope. I will be I will be watching TV with my children.
Good choice. Dr. Girod, final thoughts today.
Yeah, well, we're just grateful for everybody's work to help us get through this semester and successfully. Students still have finals to take after Thanksgiving, so they're not officially done, but classes are officially done. And it's been an amazing team effort, and so proud of the team and the community to help us do that. But as Chris said, we got a lot of work ahead of us. And as we see the numbers spiking and as we see our hospitals filling up, it's time to buckle down and do what we need to do for the next couple months until really we start to see that vaccine starting to come available. So we're grateful to have reached this point, but we know we need to really be careful for the next couple months, and that now ceases to be our university responsibility, and it now is an individual responsibility. Thanks for everybody who helped us get here, and stay safe, keep your bubble small, and wear your mask.
And again, KU's done a great job. And from a Tiger to a Jayhawk, rock chalk, well done. Dana Hawkinson, final thoughts.
I would like to echo Chris's comments. Absolutely, Wednesday night before Thanksgiving night when you have the lighting, the plaza lighting ceremony and people going on after, those are a couple of the most fun nights in Kansas City. But this year we can't do that. We have to be vigilant and understand that the things that we do now while we are home, or if we've never left and we are still just here, those things will have huge lasting impacts on how we move through these next couple months. And so it's important to be vigilant now and do those things that we've talked about so that we can get through these next few months, next 2 to 3 months, 6 to 9 months, until we get vaccines and better therapeutics, because there is a light at the end of the tunnel. But right now we just have to do things a little bit different than we have been doing them and stay vigilant, do the masking, not meeting in large group gatherings, social distancing, hand hygiene, all of those things to keep safe, moving from Thanksgiving to the Christmas and New Year's holiday and even beyond.
Yeah. So I'm going to return to Dr. Girod in just a moment. Thursday and Friday, we are not having an update. We're going to have a couple days off and hang out with our families. We'll be back on Monday with Rachel Leesman, Rick Coldry. We're going to talk about COVID-19 testing because that's going to be incredibly important. We have some really great programs for next week before we go into vaccine week. And I think the vaccine week, begun on December 7th, will be a really important conversation. As the world pauses for just a moment, or at least the United States pauses, around Thanksgiving, I think sometimes the things I am most thankful for are the heroes in my life. And there have been a lot of those heroes. My parents and then really some of the great physicians I've had to work with. I think of them as giants and people like Rudy Napadano or Bill Hall back in Rochester and Dr. Diedrich here in Kansas City and Norton Greenberger and other people who are giants in their field. And I think about all the folks like Anil Garmarkar, who's been on our show. I think Anil's a hero because of the stories that he tells us. As we face down the coronavirus, ask yourself, who are your heroes? And what would your heroes do? And this is what I believe. If we're going to beat the coronavirus and bend the curve, we can't just depend upon a day when vaccines come. We have to depend upon our heroes, and our greatest heroes can be ourselves. You can be the hero. And you can do it by doing things that are hard. And the things that are hard to do are to buck the trend or buck the curve. And the way you can do that around coronavirus is follow the rules of infection control. Who's the hero? You're the hero. Let's all be a hero around Thanksgiving. You know, one of the heroes at KU, I think, is Bill Self. Dr. Girod, Bill Self has got a great message for us today.
He does. And as we talked about earlier in the show, we've made the decision not to have fans in the stands in November and now early December, and so that will capture the first couple home KU games, both men and women's. And that's not because we think the field house is not safe. We've got a great plan for the field house. It's just because of the high density of the disease in our community, which is really challenging our hospital capacity right now. And that's really the driving force behind that conversation. So I think Bill's got a great message for us to think about how we approach his basketball season.
Thank you, and thank you guys for being on the program. Thanks for all the great work you do, and thanks to all of our listeners out there, to our studio team in here. They do amazing work. To Jill, who tries to keep me in line. That's a really hard job, another hero. And to all of you out there, remember, be the hero. Stay safe on Thanksgiving. Let's hear what one of our heroes, Bill Self, has to say.
I know my team, and you are as well, very excited for the upcoming 2020-2021 basketball season. I'm standing here right now in the greatest arena in the world, an empty Allen Fieldhouse. And unfortunately, the first two games at home in December are going to be played with this many fans in attendance. That can change, but we all have to do our part. This Thanksgiving, and of course with the Christmas holiday coming up, don't let your guard down. Mask up, keep social distancing, wash your hands. With a vaccine that's relatively imminent on its way, this is a time that we really need to bow our neck and be disciplined and not take a step backwards. You have spoiled us rotten in the past over my time here, and of course, dating back generations of what a special place this is and how hard it is to win in this place. We need to bring those days back, and it won't happen unless we all do our job. So enjoy the holidays, enjoy the family if you can. Keep your circle small, mask up, social distance, wash your hands, and I hope to see you here soon.